Generally with polycystic ovarian syndrome, you have really high egg reserve. And kind of the problem with this disorder is that brain and ovary have a hard time communicating with one another. So when we go to ovulate, this is relying on the brain sending a signal to the ovary of a hormone called follicle stimulating hormone. It does exactly what the name suggests. It's a hormone that stimulates follicles to grow. And this is because every cycle you have sort of a group of follicles, which are fluid-filled sacs, each containing an egg, that rise to the surface of the ovary. And they're competing with one another on which one will continue to grow and eventually release an egg. This process of which one gets selected is super random, but it really relies on this hormonal stimulation. When you suppress the ovaries long enough, and then you sort of have a response, or you sort of let yourself try to ovulate naturally, for instance, being on birth control pills for a long time or breastfeeding and being pregnant, then you don't have any form of hormonal suppression. It's easier for the body to recruit a follicle and release an egg in the first couple of months. But then another phenomenon tends to happen with PCOS. As you get older and your egg reserve starts to decline, we see that sometimes all of a sudden you are ovulating on your own without the need of medications.